Hello, we're going to discuss various things about bullies and about bullies victims and how we uh, view them and how we can protect ourselves from bullies. As each slide progresses, I hope you have questions for your teachers or maybe your classmates. I hope you engage with each other with talking and discussing this subject. And keep in mind that all questions are welcome. One of the most important things we have to learn in life as children, um, teenagers, and adults, and something sometimes we have to relearn, is that the decisions we make, the choices we make, whether they're good or bad, can affect us our entire lives, especially bad choices. And as your teachers, especially in elementary school, probably taught you that your choices have consequences. If, for instance, you are arrested, especially for a violent crime, that record is going to follow you for years and years, and not your entire life. Um, you may not have the opportunity to follow your dreams. You may not be able to get into a university or college, or at least the one that you want to, because university and colleges do check criminal backgrounds. Same way with employers, whether it's a fast food restaurant or a major corporation like Microsoft, will check for your criminal background. Um, some people who have been in prison for violent crimes have extreme difficulty finding a decent job. And sometimes they're desperate, and on their application, they will lie about their criminal record. They will state that they have never been arrested. And they hope that that company doesn't check their background. But when the company does, and they find out that that new employee lied on their application, lied about having a criminal background, that employee will be fired for falsifying their application. And it's a sad situation. Now, if you are trying to get a job, let's say you get an education as a bookkeeper or maybe a CPA even, and you're involved in working with financial information, that company is definitely going to check your background. Same thing with security, whether or not you are protecting a large building or you are hired and you deal with sensitive monetary information. And as an example, if you're in the military and they are training you for a job that involves top secret information, the Army does not check your background. The FBI does, and they do a very thorough background investigation. They don't just get on a computer and see if you have a criminal background. They will talk to your spouse. If you have an ex-spouse, an ex-girlfriend, or a current girlfriend, they will speak with them. They will speak to your mom and dad. They will speak to your neighbors. And they will try and find out everything they can about you and your character, not just if you have ever been arrested. They want to know if you're someone that can be trusted. Now, if you have been arrested or you do get arrested, uh, doesn't mean that your life is over and you should just give up. No, it just means that you have to work harder to get back to where you need to be. to get on the right track of getting an education, whether it be through a university or a trade school, and on the right track as far as getting a decent job. Many ex-convicts, people who've been to prison, they go on to lead productive lives. But as well, unfortunately, many ex-convicts end up being arrested, even somewhere, say, as 10 years later down the line. And there's various reasons for that, but that's a subject for another day. Now, when we're talking about bullies, and let's say we're going to talk about adult bullies, they have difficulties in developing the appropriate social skills. The bulk or the majority of their social interactions as an adolescent are based on power and control. And that's what being a bully is all about, power and control. You want power over people through fear. You want to be able to control them because of fear. If someone doesn't stand up to you, if you're a bully and someone doesn't stand up to you or say anything to you, it's not because they respect you. It's because they're afraid of you. And that's a very sad situation. But for these people, concepts about such things as compromising with someone or setting boundaries, they just don't develop in a healthy manner for these people. And part of this is learned behaviors, what I call learned behavior, and other people call it learned behavior. But learned behavior is something that we attain or we get from our day-to-day experiences. An example would be when you're in kindergarten, you learn to follow the rules involving other students. You learn to how to line up and hopefully how to act appropriate, say in the hallway. You learn that cutting in line is not good. And as the teacher talks to you and reminds you on a day-to-day basis, soon that becomes a habit for you. And that's a positive example of learned behavior. On the other hand, if you start hanging out with friends or other kids that are bad students, that are disrespectful to their teachers, are disrespectful to other students. Maybe they are smoking, using alcohol or drugs. Sooner or later, you're going to start behaving that way. And that's a negative example of learned behavior. We're going to discuss a man named Lance Hind. He had been the superintendent of Katy ISD. Katy, Texas is about 30 miles west of Houston. And he had been the superintendent there from 2016 to 2018. So only 2 years, a short time. Now, he had grown up in Katy, Texas. He went to school there, with the exception of his high school years. His parents had moved, so he went to high school in a different town. After high school, he went on to college, earned a bachelor's degree, and then he went to a different college and earned a master's degree. So Mr. Hind was, or is, an intelligent person. And after that, he became a very successful teacher here in Texas. And then he eventually became the superintendent of a school district here in Texas. And by all reports, he was well liked and he did a very good job. In the year 2016, the position for the superintendent of KDISD was available, and he applied for the job, and he got the job. So he was able to move back to his hometown and be the superintendent of that school district. And again, he had a good reputation, and he did some good things for the school district. Now, in 2018, the last year that he worked as the superintendent of the school district, during a school board meeting, a parent stood up and addressed the issue of bullies. And the parent felt that the school district was not doing enough to address the issue of bullies. And that parent wanted more done. During a following school board meeting, a man stood up and he addressed the school board and addressed Lance Hind. And he stated that in school, he had been severely bullied and teased about his last name, which at the time was Gay, G-A-Y, Gay. Now, I want you to consider something, that if you were teased about your name, bullied, if you were teased and bullied about anything, how bad you would feel every day coming to school, worried and scared of what's going to happen next. And you have to realize that, when you get out of high school, maybe the bullying and teasing stops, but the emotional stress, the emotional trauma stays with you, and it stays with you for years. Unfortunately, it does not stop when you get out of high school. And as an adult, Mr. Gay changed his name to Barrett. And I want you to consider how sad it would be for you to have to change your last name because you were teased and bullied about it. And as far as standing up in front of the school board and talking about this issue, it took a lot of courage to stand up in a room full of people that you don't know and talk about being bullied as a child. And not a lot of people can do that. Now, he stated that a bully had once shoved his head in a urinal, which had cut his lip. I don't know how bad the lip was cut, but getting your head shoved into a urinal is bad enough. That's terrible. Now, he felt that no one in the school system would help him. Now, in part, a lot of people, kids and adults who are bullied and teased, they don't feel like they can find help anywhere. And if you're a student, say in high school, and you're being bullied and teased, you may feel the same way, that no one's willing to help you, your parents or a teacher or someone in school. And that can be a natural feeling because you feel helpless. And in part, you're scared to seek out help because you're scared that you won't get that help. Now, the other part of this is that Lance Hind wasn't just bullied and teased by students. He was bullied and teased by teachers, which, being bullied and teased by students is bad enough, but to be bullied and teased by a teacher, I mean, how horrible. And there was at least once he had gone home and he considered committing suicide. He considered killing himself because of all the stress he was under. Fortunately, he did not do that. Now, as he's talking about this to the school board and Superintendent Lance Hind, he looked directly at Superintendent Hind and he said, "Lance, you were the one that shoved my head into the urinal." Now, Superintendent Hind, he laughed it off and he denied the allegations. even to a reporter. I mean, it was in the paper that he was denying that this ever happened. Now, in a following school board meeting, a man stood up and stated that he had been a witness to the bathroom incident. And he stated about Lance Hyde that Lance Hyde had been a bully. He was a bully, and he let people know he was in charge. And nobody messed with Lance Hyde. And again, Lance Hyde denied the allegations. Then, in another school board meeting, a second witness came forward. And up until this point, I'm going to say that not a lot of people, including the school board, took these allegations seriously. But then the second witness came forward, and he was someone that was difficult to ignore because he was someone in a position of authority. He was now a criminal court judge. But he stated about Lance Hyde, he stated that he was a vicious bully, he was a thug who bragged about beating up people, and he also stated that he thought that Lance would have ended up in prison somewhere based on the way he behaved in high school. Lance Hyde continued to deny the allegations, but later that same year, 2018, he lost his job as the Katy ISD superintendent. Now, there's much more to the story, and if researching bullies is something you might want to do at some point, Lance Hyde is a good place to start. Who can be a bully? Well, basically anyone. Could be a boy or girl, man or woman. They come in all shapes and sizes. And they come from all different backgrounds. They can come from a wealthy background. They can come from a poor background, a background of really good education, a background of very poor education. And you can't just look at someone and say, "Oh man, he's a bully." No, it's not the way they look. It's not the way they dress. It's not the home they live in or the car they drive. It is their character. To use a phrase that Dr. Martin Luther King once said, the content of their character. And that's what's important. What does it mean to bully? What is bullying? A bully can be just one person, whether it's a boy or girl, man or woman, or it can be a group of people, two or more ganging up on a victim. Now, I use that word victim intentionally. If you're walking home from school, someone runs up and steals your backpack, runs away with it, you're the victim of a crime. You're the victim of a theft. Now, if someone is bullying you, you're the victim of a bully. And that can certainly be a crime, especially if they touch you or take something that belongs to you. That's a crime of assault or theft. Now, basically, bullying is unwanted aggressive behavior that is repeated or has the potential to be repeated. And what I mean by the potential to be repeated, if a bully is picking on someone and they get away with it, maybe that victim doesn't stand up for themselves. Maybe other children who witness this bullying, they don't do anything, or maybe a teacher sees it, doesn't do anything. The bully knows that they're going to get away with it. And more than likely, they will repeat the behavior. Um, Now, bullying can cause serious, lasting problems, not just for children, but adults. And as I said earlier, if you're bullied in high school and you graduate from high school and you move away from the bullies, the bullying may stop, but that emotional trauma that you live with every day continues. That doesn't stop when you get out of high school. It goes with you. And it can get worse. Now we're going to talk about a neurological disorder, a brain disorder called Tourette's syndrome. And I have a reason for it. I'll explain. But again, Tourette's syndrome is a neurological disorder and it affects children, adolescents, and adults. It's characterized by sudden involuntary movements or sounds, involuntary sounds. It's called tics, Tics. Um, it could be something as simple as eye blinking. I had a good friend years and years ago who had a son who had Tourette's, and his primary symptom was eye blinking. It could be facial grimacing, it could be jaw movements, head jerking, arm jerking. It could also involve the vocal tics or the sound tics. It could be something as simple as clearing your throat or maybe coughing. But it's not just clearing your throat or coughing. You're doing it over and over and over, and you cannot stop it. It could involve something worse like shouting, just shouting out a word or a phrase. And again, it's not done intentionally. It's that person cannot help themselves. Now, these are just a few of the symptoms. There's more. Now, uh, these symptoms, they can be very mild. Maybe say with the eye blinking, maybe other people notice it, maybe they don't because it's so mild, or it can be very severe that disturbs the person every day, that other people, whether they're fellow students or maybe coworkers, obviously notice. And it can be so bad that that person cannot function in public. Now, I bring up the Tourette's syndrome for a reason, is because people with Tourette's syndrome are bullied more often than people who do not have Tourette's syndrome. So, for those people with Tourette's syndrome, bullying is a much more common problem. And again, how bad, how sad that someone with a medical problem is being made fun of. I mean, we wouldn't make fun of someone with diabetes. We wouldn't make fun of someone who had cancer. Why would we make fun of anyone with any type of medical problem? Bullying can also come in the form of verbal aggression. It can involve teasing, name calling, verbal threats, someone threatening to hurt you or kick you out of class or whatever. It can involve taunting, putting someone down, or threatening to cause harm. Now, it's not unexpected when, say, two people are together, say children or adults, and maybe they're playing a video game. And it's not uncommon for them to start teasing each other back and forth. And it's done on a friendly basis. It's done with the acceptance of both people. Now, it can become serious when one person starts to get offended. Maybe the teasing goes on too long, or maybe the other person says something that offends you. And then the teasing needs to stop because it's no longer fun. Now, sometimes when a bully is, say, making fun of someone, especially in public, and there are other children around, and maybe the bully makes fun of their name and starts laughing, and maybe other kids start laughing. Uh, it's not uncommon for that victim to laugh along with the bully. And it doesn't mean that they find the situation funny. It just that they're trying to demonstrate that they're not affected by the taunts and the threats and the teasing. It could be a way of coping for that victim. The victim may laugh along, trying to tell themselves that they're not offended by it, but they are. It could be a way for the victim to show disrespect for the bully. And sometimes in these cases, more often than not, the bully doesn't realize that the victim is demonstrating disrespect toward them. Um, Another form of bullying, it comes in the form of social aggression. Uh, it involves hurting someone's reputation or hurting someone's relationship. Maybe you spread rumors behind their back. Maybe a boy and a girl have a relationship, they're dating, they're going steady, whatever the term is now. But maybe someone, for whatever reason, starts spreading a rumor about one or both of them, and it hurts both of them, and they ended up no longer dating. They're the victim of bullies. Social bullying can include leaving someone out on purpose. Maybe you're choosing sides for a basketball game, and you intentionally leave someone out. You intentionally don't choose someone to play. And that's done over and over. Maybe it's just simply because you don't like them. Maybe it's because of the way they dress. Maybe they have a different accent from yours. It could be for any reason. It can also involve a bully telling other children not to be friends with that person for whatever reason, um, or embarrassing them in public. Um, Bullying can be in person, but it can also come in the form of electronic aggression through social media, which you may or may not be familiar with the term cyberbullying. And it is a severe problem in our society nowadays. It's very severe. But it can include making threats, saying, making something embarrassing about the person. It can be done through emails, text messaging, or social media posts. But it is a problem in our society. Who are the victims of bullies? I think in general, most of us probably know the answer, but the victims of bullies generally are smaller people, weaker people, or people who are perceived to be weak. Um, Sometimes people confuse kindness with weakness. People who are very nice or very polite, sometimes bullies will think that they're weak and easily uh, terrorized. But if you look in the wild, use an example, lions in Africa, they will find a herd, say, such as antelopes, who are grazing or maybe getting water, and they will just kind of lay down and they will start watching these antelopes. And they'll look for a smaller antelope or maybe an adult antelope that kind of wanders away from the herd. Um, One that's not paying attention, or maybe one that's obviously injured and is out walking, unable to walk properly. But they look for those animals, those antelopes, or whatever their prey happens to be, but they look for the smaller ones, the weaker ones, and they target them, and they go after them and attack them. And that's exactly what bullies do. It's no different. Um, the victims of bullies can be me, you, one of your friends, maybe a parent, maybe a teacher. Anyone can be a victim of a bully. It just doesn't take much. One of the most difficult things we have to do is decide how to respond to a bully. The most important thing is that we don't want them to harass us. We don't want them to hurt us. One of the most difficult things to do as far as responding to a bully is just ignore them. If that's possible. Now, if they're, just in your face, if they're hitting you, getting physical with you, that's very difficult to ignore. But if they're teasing you from a distance, just ignore them. Walk away. Hopefully, after a day or 2 or 3 days, sooner or later, the bully is going to get tired of trying to harass you. He's going to get tired of being ignored, and he'll move on. Unfortunately, they will move on to another victim, but hopefully they'll leave you alone. Now, another way is to just be polite, be very polite to them. You can let them know that you don't think they're funny. You let them know that you don't think that they're all that tough. Be polite. Tell them to have a nice day. And walk away. Now, that doesn't always work. Sometimes a bully will follow you. But a bully is looking for a reaction from you. Maybe that bully wants you to cry. Maybe that bully wants you to look scared, act afraid. But if you're just calm, if you're confident, and you don't react the way they want you to react, again, they will get tired of messing with you because they will realize that you're not going to play their game. Now, again, that's not the easiest thing in the world. Sometimes it takes practice. But if you practice something long enough, you'll be fairly proficient at it. I'm sure there's other ways to respond to a bully, appropriate ways to respond to a bully, and that's something you can discuss with your class and your teacher. How do we ask for help when we're bullied? There's any number of ways. The first person that you should ask is a parent, whether it be your mother, father, or maybe someone else is raising you, say your grandmother or whoever. Hopefully you can go to them and hopefully they can help you appropriately. Now, sometimes when we go to someone for help, they don't really have a good answer for us. They can't really help us the way they should. And it's not because of a lack of caring. It's a lack of understanding and a lack of education on their part. You may go to that parent and say, I'll be bullied at school, this, that, and the other. And that parent may just tell you, oh, Don't worry about it. Just ignore it. You ignore them and they will ignore you. And unfortunately, that's not good advice. But that person's doing their best they can. But if you don't get good advice, or maybe you don't get advice at all, there's always other people to go to. And now, when we're talking about parents, sometimes the parent is the bully. So you can't go to your parent. Maybe you can go to a trusted family member, an aunt or an uncle or an adult cousin, whatever, and hopefully you can get help that way. Now, you can always go to a teacher, a school counselor, the principal, or some other school official that you have a good working relationship with, maybe your math teacher or music teacher, whoever. You can always go to a police officer. Um, but there's always help. And the first person you ask, again, the first person you ask may not be able to help you at all. And things like that happen. Just move on to someone else. You will find someone to help you. Um, what if you're someone who witnesses another student, whether it be a friend or not, or even someone you may not know? But how do you help them? Uh, it takes a lot of courage to stand up for not only yourself, but someone else you don't know. But you can try talking to the bully, let that bully know that their actions aren't appreciated and that they should stop. And if that doesn't help, if that doesn't stop the behavior, then go to a school official. Another way of helping someone who's being bullied is talk with them. Go up and offer to talk with them. If they're open to a hug, give them a hug. A hug goes a long ways. Now, some people aren't into hugs, and that's okay. Now, usually victims of bullies, sometimes they don't want to be talked to. They just want to talk. They want to vent their frustrations and their anger and the emotional trauma that they're having. And they may not start talking just right away. You may have to just walk with them or sit with them for a little bit, and they may start talking on their own, and just let them talk. It's not about you, it's about them. So let them talk. And listen without making judgments. And when it's acceptable, possible, tell an adult you trust. If the bullying is happening at school, tell a teacher, principal, administrator, counselor, whoever. Another way to help someone is, if you and your friends are, say, outside and you witness another person being bullied, then take a stand as a group. As a group, you approach that bully. Now, bullies, as we mentioned earlier, it's all about control and power. The power of fear and controlling someone by fear. Now, the problem with bullies is that they're not brave. They are not brave people. And when confronted, especially by a group of people, they're more than likely going to back down. They may make some threats or something, but they're generally going to walk away. Now, if this situation happens, you need to follow it up with talking to an adult. And if it's a school, talk to somebody in the school. Another way of helping someone who's being bullied is don't repeat rumors. If you hear some rumor about a student, unless you know it to be true, it is a rumor. And just because this person said something or that person said something doesn't make it true. You only know it to be true if you witnessed it yourself, if you saw it for yourself, if you heard it for yourself. When you hear it from someone else, that is secondhand news. That is a rumor. Now, another way of helping someone who is being bullied is to educate them. Educate them. Let them know that there's help out there through a parent, through a teacher, whoever. But sometimes it takes a little bit of education to help these people get the help they need. The effects of being bullied, especially long-term effects. Now, we touched base with it uh, a couple of slides back when we talked about that when you graduate high school, you leave those bullies behind and you move on with your life. You may leave the bullies behind, but the emotional trauma, the anguish, the emotional pain, it continues and it can continue for years. Now, the effects of bullying, it can be something like loneliness. You may feel you're alone in the world. There's no one to help you. You may become severely depressed or severely anxious. And it may take a while for you to realize that you have depression or have anxiety. It may take you going to a counselor or a psychologist and talking with that person. And that healthcare worker isn't going to diagnose you with depression or anxiety on the first visit. It may take a few visits for them to decide, for them to listen to what you're saying, how you're saying, and decide the appropriate diagnosis. Now, the one thing with depression and anxiety, sometimes they can go together, sometimes not. Some of the symptoms that you have for either one apply to the other. Some of the symptoms for depression apply to anxiety and vice versa. So it's important that you don't self-diagnose. Don't use Google to self-diagnose. Go to, if you have to, start with your family doctor, and they can point you in the right direction. But you're feeling this way, it's important to get mental health help. And getting mental health help is no different than seeking help for an illness, the flu, or getting help for, say, stomach pain. Another effect of being bullied is low self-esteem. You just don't have a lot of confidence in yourself. You think you're a loser. You think you'll never achieve anything. And there's also, with these feelings, you have an increased chance of becoming ill. You have an increased chance of becoming sick. And it's just a result. But maybe you start having stomach pain. Maybe you develop an ulcer. And that's directly, or could be directly, related to being bullied. It could be so severe, being bullied, you could be so severe as you're having suicidal ideations, or that's just another way of saying you're thinking about suicide. Maybe you don't have a plan. Maybe you're just thinking about it. Maybe you do start thinking about a plan. But when you start having these thoughts of suicide, again, you need to seek help. And if that means you start with asking a teacher, it's a good place to start. That teacher will get you to the right help. Another way of dealing with being bullied is self-harm. One way of self-harm is cutting. Whether you're cutting your arms or you're cutting your leg, But it's just a way of you're creating physical pain to try and mask the emotional pain. Now, there's a lot more to cutting than just that explanation. There's a lot more to it and much more complicated, but that's a basic definition of it. Another way of self harm is self medicating. Um, it's when you're taking an over the counter medicine, or maybe you're taking a friend's medicine or a parent's medicine without that parent's knowledge, and you're trying to make yourself feel better. And more than likely, you're just going to make yourself worse. One way of self medicating is the use of alcohol or street drugs. Now, in these situations, that doesn't mean you're addicted to alcohol. It does not mean you're addicted to street drugs. You're just merely using one of those or both as a way of helping you feel better, helping you forget the stress you're having. Now, if you use alcohol long enough, you will become addicted. Um, some street drugs, it could take a while for you to become addicted with constant use. Other drugs, say like methamphetamines, you can get addicted on the first use. And that is no way to continue on with your life. That just creates more problems for you. Um, and like I mentioned, these long-term and intense bullying can cause these issues to continue way into adulthood. And the key is to stop that mental anguish as soon as you can. It may take a while. A mental health professional or doctor may put you on a certain medication. And one of the unfortunate things about our society is that we live in what I call a microwave society. We put food into the microwave in a few seconds. It's all cooked and warm for us. And unfortunately, some of us feel that's how life should be. That if we start taking a medication, it should work instantly. And it just doesn't work that way. If you start taking an antibiotic for an illness, it takes those antibiotics a few days to start working. And then it takes a few days for you to start feeling better. It doesn't happen overnight. Same thing with mental health medications. If you're having anxiety or depression, whatever, if you're bipolar, ADHD, whatever issue you're having, and you're put on a medication, it usually takes those psychological medications, those psychiatric medications, usually takes them about a month to start working. Nobody likes to wait a month, but that's just the way the medications work. And sometimes people start taking these medications and it makes them feel worse. Maybe they're having stomach issues, or maybe their depression gets worse. And these things can happen, but the patient, stops taking the medications because it makes them feel worse. But they do not speak with their parents, or they don't speak with their doctor about this situation. And if you're a child living at home, your parents cannot help you if you don't tell them what's going on. Same way with the doctor. The doctor cannot help you if the doctor doesn't know what's going on. And you have to be open and truthful. And so if you're having bad side effects, and as far as all medications have side effects, some of them can be very temporary. You might have a couple of days of nausea with medication, and then it goes away. Sometimes maybe that nausea is long term. Um, the same way with psychiatric medications. Some of those side effects may be long term. And so you stop taking that medication. Well, the doctor can't help you if the doctor doesn't know, because there's all kinds of psychiatric medications out there. And it's not difficult to change the patient from one medication to another medication. Um, Another area is that an adolescent who's constantly bullied to a high degree can suffer from long-term strain on the sympathetic nervous system, which is a part of the brain, and it causes physical health and alterations in stress reactivity later in life. That's kind of a long, fancy sentence, but um, if you're in high school, you can certainly, or even younger, you can certainly research the sympathetic nervous system to see how it works and what kind of changes due to high stress. In general, why do people become bullies? There's a number of reasons. It could be something as simple as immaturity, either as a child or as an adult. Now, that none of these reasons excuse the bully for their actions. It just helps explain why they are the way they are. But it can also be due to ignorance. Person just doesn't really know that they're hurting someone else. And it can be learned behavior. We kind of talked about learned behavior earlier, but your environment can affect your behavior in your future. Um, if you live in a good environment, you don't hang out with the wrong people, you're not influenced by the wrong people, hopefully you won't become a bully. Hopefully you'll have a very long, productive life. Now, on the other hand, if you live in a bad environment, uh, that's going to affect you. Let's say you become friends with somebody and that person's hanging out with the wrong crowd, and that person was part of the wrong crowd. Maybe they're anti-school, they refuse to study, they refuse to learn. Maybe they're picking on people, they're bullying people. Maybe they smoke, maybe they're using alcohol or street drugs. And if you hang out with these people long enough, you will become like them, and you will start having bad grades. You'll get a bad reputation with your teachers. You will become a bully yourself. If they're smoking, you will start smoking sooner or later. If they're drinking alcohol, the same. If they're using street drugs, the same. If they're selling drugs, good chance you will become a drug seller. It's all about your environment. Now, that doesn't mean that someone from a good household, we'll use that phrase, good household, they can develop issues for whatever reason, for various reasons. Um, but generally, if you have a good, solid, healthy background, you're hanging out with the right people, um, you're going to do good. Now, unfortunately, sometimes children have little or no control over their environment, especially the smaller children. Um, Children don't uh, choose the families they're born into. Um, if you're born into a family, you live with parents who abuse alcohol or abuse street drugs, you're going to be affected by that. If you have family members, siblings or cousins or uncles or aunts who act that way and you spend a lot of time with them, then you will start to mimic them. You want to be like them. And the reverse can be true. If you have great family members, you have great friends at school, then that sets you on the path for making good choices. Now, one thing, bullies never admit they're bullies. They never admit they're hurting someone. They will never admit it. And that's just one of the issues with bullies. Um, why do children become bullies? we're going to discuss why children become bullies. And in the next slide, we'll discuss adults. Now, some of the information we discuss in this slide applies to the next slide. So you may hear it twice. Now, sometimes children are just plain mean. There could be a reason. There may not be a diagnosable reason. Could be something as simple as the child is on a certain medication. One of the side effects could be that it causes aggression within that person. And that person taking the medication just isn't aware. It's not like they woke up one day and suddenly they're abusive and aggressive and they become bullies. It happens over a period of days, if not weeks. And it's up to the parent and or the doctor to realize that that child is having that issue and figure out the reason why. And sometimes, if it's the case of a medication, they simply put that child on a different medication and the symptoms will hopefully go away. A severe problem with why children can become bullies is neglect or abuse of that child by a family member or a family friend, a close family friend. It could be verbal, it could be emotional, it could be physical. And unless the child tells someone who's going to do something about it, look into it, then the child is helpless to deal with it. Now, one thing, if a child is committing violence against an animal, say their dog or cat or the neighbor's dog or cat or whatever other animals may be around, this often represents displaced hostility and aggression, and it stems from that neglect or abuse. And in other words, that child is feeling that stress, that emotional trauma, and they have to deal with it. And unfortunately, they may deal with it by violence against an animal. Now, mental health issues. We kind of talked about this earlier, but sometimes people don't take their medication. They just don't take it because they don't like it or like what it does. And like I said earlier, if the doctor or your parent isn't aware of the problem that you're having with the medication, they can't do anything about it. If you're having some severe side effects, there's many other mental health medications out there. And sometimes the doctor will give you the right medication, the right dose, and it works for you. Sometimes the doctor puts you on a medication. Maybe they have to change the dose a little bit. Or maybe they just have to change the medication to something else. But there's always alternatives. Sometimes people don't take their medication properly. Some days they take it, some days they don't. Some weeks they take it, some weeks they don't. I'm a retired paramedic, and years ago I dealt with I want to say he was about 9 years old. I don't remember the mental health issue that he had. Part of it involved severe aggression and violence toward his mother and his siblings. His father, sometimes the father was at home, and then there were long periods of time where the father was not at home. When the father wasn't at home, his mother kept him on the medication every day. When the father came home and saw the medication, he would throw it away. He was an abusive husband and he was an abusive father, but he would tell the child, you don't need this medication, and he would throw the medicine away. The child wouldn't be able to take it. And then he would start becoming violent again. and me and my partner on the ambulance, we got called to this residence, and because the child was being extremely violent toward his family, and I mean, this 8 or 9 year old child attacked us, and we had to restrain him. We had to physically tie him down so he couldn't hurt himself or hurt us. Um, that was a sad situation. But again, this also applies to adults. As I mentioned, all medications, I don't care what they are, an antibiotic, a stomach medication, whatever, I don't care what it is, it could be Tylenol. All medications have side effects. Some are minor, some are extremely severe. Some side effects go away after a short period of time, some will not. The important thing to remember is that your doctor cannot help you if they do not know what's going on with you and your medications. Um, and again, if you're having bad side effects, the doctor can always change your medication. Um, Sometimes they're taking their medication, but they're also using alcohol or drugs, street drugs. And mental health medications do not mix well with alcohol or street drugs. Uh, they can make your symptoms, your problems, much more severe. They can make your depression much more severe. They can make your aggressive behavior much more severe. Um, there is no good reason to take alcohol or street drugs. Well, there's no good reason to take street drugs. And as a child, you should not be drinking alcohol. As a teenager, you should not be drinking alcohol. Um, but if you're mixing it with healthcare medications, you're not doing yourself any favors. Now, as I mentioned earlier, um, just because you're self-medicating with alcohol or street drugs or maybe your parents' medication doesn't make you a drug addict or addicted to alcohol, but it can certainly lead to that. Now, one of the growing problems in this country and has been for decades is the increased use of alcohol or street drugs by young people. And I came across one piece of information that suggested that the youngest drug abuse age is approximately 12 years old. And approximately almost 9% of all eighth graders, the 13 to 14-year-olds, have used an illegal drug within the past month. And that's a sad situation. That's a sad state of affairs for our society. Now, another reason that we touched on briefly, your home life. If you're under verbal or emotional abuse, long term, that's going to affect you. If you're being physically abused, hitting, slapping, kicking, improper, or inappropriate touching or unsafe touching, that's also physical abuse. Spanking can be something that's abused by the parents. Some parents spank, some don't. But there have been studies, and one study suggests that the effects of spanking have shown that corporal punishment or punishment by hitting increases the likelihood of perceived anger problems later in life because it's learned behavior, and that the response to conflict is to escalate the aggression. So in other words, if you're being physically abused, if you do something wrong and you're physically abused about it, it's quite possible that you will continue with that inappropriate behavior and it'll make it worse. But in general, spanking is a less effective way of disciplining a child because the child typically responds to the negative behavior addressed with aggressive behavior on the part of the parent. In other words, the child reacts to the physical abuse. And it's just not an effective method of teaching the child why their behavior was inappropriate. There's other forms. A child can be, their privileges can be removed. They may not be allowed to have friends over for a while, say if they don't do their chores or they don't clean up a mess. Spanking doesn't teach anything about that problem. It just teaches the child that they're going to suffer pain and humiliation if they make a mistake. And there's a direct connection between action and consequence. Kind of like how your teachers will sometimes tell you that your actions, your behavior have consequences. And the consequence of spanking or other forms of physical punishment, such as hitting, teaches the child to hide their behavior as a way of avoiding the punishment. If you may make a mess, you may try and hide it from your parents so you don't suffer that punishment. So, the spanking doesn't change the behavior. Instead, of changing behavior to seek a reward. Spanking at the moment something is discovered while the parent is angry and without talking with the child sends the message that they are being spanked because the parent's angry and disapproves, instead of sending the message or teaching that the action or their behavior itself was wrong. So if you spill juice on the carpet when you're supposed to keep juice in the kitchen, the parent becomes angry and spanks you, you associate the spanking with that parent's anger rather than associating it with your mistake of bringing juice onto the carpet. Now, all this is typical behavior, typical responses, because nothing is 100%. Not everything is true 100% of the time. Our society used to spank a lot. And in fact, when I was a child, elementary, if we did something wrong in school, we got spanked either by the teacher or the principal. And they had these huge boards that they spanked us with. And that was just the way society was then. Fortunately, society's not that way anymore. But our society took the you should not spank your kids to an extreme. In other words, society now doesn't want children to be spanked, but it's taking it to an extreme measure and just stop giving consequences to kids. In other words, a kid doesn't make a mistake. Not only are they not spanked, but they're just not punished in any other way, which in itself causes problems because the child does not learn that their actions will have consequences. Kind of like in school. If you're goofing off in class enough, you may get sent to detention. And it's not the teacher that got you sent to detention. It was you. It was your bad behavior that got you sent to detention. And no one's responsible for your behavior but you. Also, as far as spanking goes, is the child spanked for every inappropriate behavior, every mistake, minor actions versus more serious actions or mistakes? Is a child spanked with a hand versus a belt or some other weapon? Is a child spanked hard enough to cause an injury? Um, you know, is the child spanked hard enough to cause severe redness or blisters, severe pain that the child feels for a period of hours, if not days? Now, changing the subject, we'll go on to inappropriate touching, unsafe touching, which is wrong on every level. But it's done by a family member or a friend, a family friend, or could be a childhood friend, or maybe a friend's parent. Um, could be your parent themselves. But that's wrong on so many levels, and it causes a lot of problems. Um, Sometimes parents are abusing alcohol and they're abusing drugs, and becoming a bully toward their toward their children is a way of dealing with their stress, their anger, their depression. Um, as I mentioned earlier, people, adults, children, they may drink alcohol or they may take drugs to help them feel better, but it doesn't help them feel better, not in the way they want. It just makes their problems worse and takes their control of their problems out of their hands and into the alcohol or drugs. And some children who are bullies at school, elementary, middle school, high school, um, when they get out of high school, they stop being a bully. Um, and they go on to lead productive lives, kind of like I mentioned earlier with the superintendent of KDISD, Mr. Lance Hind. Apparently, when he got out of high school, he stopped being a bully and he became a productive citizen and helped children. But his behavior in high school as a bully caught up with him and he lost his job. But sometimes children, they've been bullied, and so they learn to be bullies themselves. So here we are to adults. Why do adults become bullies? And it's important to understand that adult bullies operate on a set pattern. They're not interested in working things out, talking things out. They're not interested in compromise. They're not interested in solving a problem. Their way is power and domination. Just domination, another word for control, but they want to have power and control over their spouse, over their children, over their coworkers, whoever it may be. Now, an interesting thing about adults, especially men, is that men who hurt animals usually hurt people. Again, not all the time, but it could be a warning sign. And I'm not talking about someone who goes out and hunts deer, so to speak. That's not a mental health issue. It's just something that's their hobby. But men who, let's say, they hurt their dog or cat or a neighbor's pet, they generally end up hurting people simply because, well, one, it's a warning sign, but also sometimes the satisfaction they get out of hurting, say, their family dog, sometimes that satisfaction doesn't exist anymore. They no longer are satisfied by their actions against the family pet. So they take it a step further and they start hurting people. Now, keep in mind that when a parent is abusing a child, the parent is bullying a smaller, weaker victim. And that's a crime. It's not the child's fault. Even if the child makes a mistake, even if the child spills juice on the carpet, it is not the child's fault that they're being verbally abused, emotionally abused, physically abused. Um, Another issue for adults is that being bullied as a child may cause them to continue being a bully as an adult. Um, some issues with adults, maybe they're having trouble at home. Maybe they're having difficulty with their spouse, their wife, their husband, their boyfriend, their girlfriend, whoever. Maybe they're having money problems. And maybe they're having difficulties with their children. Maybe they have a problem child. But the stress, the emotional stress gets to them. And that causes anger issues. And the adult is acting out. And what we mentioned earlier, they're having displaced hostility. In other words, the anger that they're feeling toward their money problems, they place it on the spouse or the child. Maybe that adult has mental health issues such as depression or anxiety. And these issues can lead to anger issues because they're unable to deal with those hostile feelings. Another symptom is they're ignoring one's family. They ignore their spouse, they ignore their children, they ignore the bills they have. And as we mentioned earlier, maybe they self-medicate, whether it's with over-the-counter medication or a prescribed medication that maybe belongs to the spouse. And of course, most importantly, maybe they're self-medicating with alcohol or street drugs. And again, alcohol or street drugs only make mental health medications worse. It doesn't solve the problem or make the problem better. Sometimes adults have mental health issues and they don't seek treatment. Maybe they think that they don't need it. Maybe they're afraid to seek treatment. Unfortunately, in our society, there is a stigma against people with mental health issues. If you have cancer, people will empathize with you. If you have diabetes, people may empathize with you. If you have mental health issues, people don't really know what to think of that, in part because they don't really know a whole lot about it. And so they're afraid of it. But again, as with children, maybe they're not taking their medications properly. Maybe they're on it, then off it, back and forth. And then self-medicating, as mentioned with children, self-medicating with alcohol or drugs can lead to alcohol addiction or drug addiction. So the most important message in all this is that you're having mental health issues. It's important to seek help. And if that means the first person you go to is a teacher, oh, then great. I mean, that's a big hurdle. It takes a lot of courage to go up to somebody and say, listen, I'm having a problem and I need help with it. But once you overcome that hurdle, that's the road to progress. Thank you for watching and listening to this presentation. And I hope you were able to engage with your teacher and the other students and discuss these issues. And I hope you continue to talk about these issues. And the more you talk about it, the more you learn, the more you understand it. Thank you.